Sir, what is your technique of lamina-specific rotator cuff repair and how it is different from the conventional rotator cuff repair that we do routinely?
So there is a thing to understand that rotator cuff is a laminar structure. So it is said that rotator cuff is made up of multiple laminas. So there is a study which says that it is made up of even 5 laminas. But practically what we see is definitely 2 differential lamina, and we are able to appreciate these 2 different laminas in approximately 70 to 80% of rotator cuff tear patients. And these 2 laminas are lying at different locations. So in some patients, like the inner lamina is here, the outer lamina is here, the inner lamina is here. In some patient, the inner lamina, outer lamina is almost at the same level, and some it is almost close. And in some patients, the inner lamina is very much retracted and outer lamina is out. So both of these laminas are lying at different locations. The crux of the success of rotator cuff repair is the inner lamina. So if you are able to repair the inner lamina well into an anatomical position, you will be able to achieve good results. Now, since these 2 laminas are located differentially and they are in differential tension, it is always better to repair these 2 laminas separately. By that, what I mean or I do is I put a medial row anchor and I do a single row repair of the inner lamina. So I can put maybe a Mason-Allen repair or maybe a 2 simple repair and repair the inner lamina. So once I have done my inner lamina, my intra-articular view will look like normal. Whole of the intra-articular area will be closed, will be covered with the inner lamina of the rotator cuff repair. And this is scientific because this inner lamina covers around 5 to 10 millimeters of the footprint. The rest of it is the outer lamina. And once we have done this, the threads which are remaining from the sutures or the tapes which are remaining from the sutures of the medial row anchor, these can be used to pass through the outer lamina. And then we do a parachute technique of a lateral row anchor. We take all these sutures through the outer lamina and put it in the lateral row anchor.
So you basically tie the knots over the inner lamina.
So we do a single row repair of the inner lamina. After that, the threads which are remaining are non-sliding threads, and these threads or the tapes are passed through the outer lamina and they are closed in a parachute fashion on the lateral row anchor. So many advantages. One, our inner lamina is definitely nicely repaired, number 1. Number 2, there are no knots on the top. So the biological healing is much better. Overall, we are doing a differential tensioning of the inner lamina and outer lamina. So both of these lamina are in different tension. Hence, the healing or strength of healing is better. We get a good area of closure. So it's a double row technique. It's a double row equivalent technique. But it will give me a better result. Even it will give me a better result than trans-osseous or trans-osseous equivalent technique, because we are actually repairing the inner lamina into an anatomical position, and rest of the threads are used to parachute closure of the outer lamina. So that's why this particular technique has definite advantages over the conventional double row technique, knotted or knotless.
So any things to look into the MRI or
so normally most of the MRI you will see 2 laminas. Okay. Most of the arthroscopy picture you will see tears, you will see 2 laminas. Some of the tears, some of these chronic tears, you might not be able to make the cleavage. So you can use your cautery to make the small cleavage between the inner and outer lamina. Otherwise, if in some cases it's very tight, so then you can do both of these laminas together. If they are not separable, then don't need to separate. But if there is a partial cleavage, you can deepen the cleavage and then you can use your suture passes to take the passages through that.
Okay. So is this cause any cost difference between the conventional?
No. So it's basically a double row repair. Okay. So the cost is same as any double row repair.
And whether the rehabilitation protocol is different or
so because it's an anatomical repair, so you can make your rehabilitation protocol a little faster than the conventional. Yes.
So you mean to say that this technique will repair the rotator cuff at its footprint anatomically and will give the better results to the patient
as compared to a conventional double row technique.
Okay. Thank you, sir, for putting your thoughts about this lamina-specific rotator cuff repair.
We have also made an animation regarding this, and we will be uploading the animation very soon.
Yes, definitely. Thank you, sir.
Thank you.